Come to another case study. So this case study is saying study the image below and answer the subsequent questions. So A, what is shown in the picture? B, what drug is used together with this device? Then C, name 2 childhood conditions where this device is used. Then D, list 4 classes. So we are on D. So list 4 classes of drugs used to treat the commonest of the 2 illnesses. Okay, so let's continue with so what is shown in the picture. So this is a nebulizer. So that's what is shown in the picture. And then what drug are used? So say this is a nebulizer. So this is a nebulizer, and this is a face. This is a face mask here. So these are just pictures for the things we attach on the which makes up the face masks in short. Then this is where we put our drugs when using together with this device, which is the next question we are talking about. So which is saying what drug is used together with this device. So the drug you can use together with this device, since I say just 1 to 1, so we're going to put salbutamol, but remember that's not the only drug. Then name 2 childhood conditions where this device is used. 2 childhood conditions where this device is used. Then list 4 classes of drugs. So 2 childhood conditions, so asthma and cystic fibrosis. But the reason why there is another case study where they asked about the nebulizer, which is also available in the case study on the channel, so you can check out that other video on the nebulizer as well, so that you check out other questions they might ask on the nebulizer. So the 2 childhood conditions we have asthma and cystic fibrosis. Then list 4 drugs, so 4 drugs of classes of drugs. So they want classes of drugs. So for the classes of drugs, one, we can have a beta 2 agonists, where we have your short acting beta blockers or short acting beta agonists. So then we have the long acting beta agonists. Then we can have corticosteroids, we can have theophylline, we can have leukotriene modifiers. Then that's mostly for asthma, so that's the commonest of the 2 conditions. Those are the four classes of drugs we can use. Okay, then maybe if you wanted to put for cystic fibrosis, then that's when you can put your bronchodilators, antibiotics, anti-inflammatory agents, and your mucolytics. But the question just wanted the commonest of the 2, which is asthma. Then additional information, if they were to ask you what are the types of this instrument, so this instrument here. So what are the type of the nebulizer? So we have jet nebulizer, which uses compressed gas to make an aerosol. Then you can also have ultrasonic nebulizer, which makes aerosol through high frequency vibrations. Then the particles are larger than with a jet nebulizer. Then the last part, or the last type of the nebulizer, is called a mesh nebulizer, which just uses a liquid that passes through a very fine mesh to form the aerosol. So that's all for this. So check out the other case study on nebulizers. That's to see how case studies come. Okay, and thank you for watching. If you haven't subscribed and hit the bell notification.